The last time we had Health Minister Elliott on this program, she was here to talk about implementing transformative change in healthcare. None of us then expected what would come to dominate and define her role would be a global pandemic. But that's where we are. So we're happy to welcome back from the downtown of the provincial capital, Elliott, the PC member for Newmarket Aurora, Deputy Premier of Ontario, and of course, Ontario's Minister of Health. Minister, it's good to see you again. How are you managing?
Oh, very well. Thank you, Steve. It's been an interesting year, to say the least, but things are looking much better for everyone.
Well, let's get into this on that front. We'll actually pick up right from where you left off, because we are, I guess, about a week and a half away from what is supposed to be entering stage 2 of the government's reopening plan. But I just checked the numbers, and I note that we have already hit the vaccination targets not only for stage 2, but also for stage 3. So my first question is, what are we still doing in stage 1?
Well, we are looking at all of the markers that we need to look at, but things are looking very positive. We have hit the vaccination targets thanks to two things. One is the people of Ontario for stepping up to be vaccinated, but it's also the incredible work that our frontline healthcare workers have been doing throughout, both in terms of caring for people in hospitals, but also for being a major part of our vaccination effort. So we're very, very grateful for that.
Again, I'll repeat the question, though. If all of those good things are happening, when we are eligible to be in stage 3, because we've hit those targets, why are we still in stage 1?
Well, we are looking at when we can move into stage 2. As you know, it's supposed to be July 2nd. But because things are looking so positive, we are reviewing it right now to determine if we can move forward a few days and get into stage 2 sooner than July 2nd. So we expect to have a statement about that very soon.
What would prevent us from moving into stage 2 sooner?
It might be the Delta variant, of course, is out there. That's something that we're really keeping a very watchful eye on. It's highly transmissible, and we've seen what's happened in places like Porcupine area, District Health Unit, as well as in Waterloo. So it's not something that we can take for granted, but we are working very hard to contain it.
How confident are you and the public health experts that you consult that we will, not can, but will avoid a 4th outbreak, and this time the Delta variant?
We are working very hard to prevent that from happening. It's looking very positive right now that we will be able to avoid a 4th wave, because we are now at 77% of adults in Ontario have received at least one dose. 27%, have received a second dose and are fully vaccinated. And we are really accelerating our efforts in 10 public health unit regions in Ontario that have more significant numbers of the Delta variants, to make sure that people can get vaccinated both for single doses and double doses there. So we're taking every step possible to prevent the Delta variant from causing a major disruption.
And the studies or the test results that you've seen, I just want to confirm this, show that the vaccinations that we have received to date will work against the Delta variant, even though it is considered to be much more virulent a strain than the original COVID-19. Is that fair to say?
Yes, it is fair to say that our vaccines are working against the Delta variant.
Okay, let's move on here. I want to talk about the vaccination program that the province of Ontario is responsible for administering. You pointed out a while ago the news has been good. The government's vaccine system has been up and rolling. I am going to put, though, some of the criticisms I've heard to date about it to you and get you to comment on that, because there have been, as opposed to sort of one central place where people go to sign up, there have been numerous portals and, qualifications that people have to meet. And, you've heard all the same things I have about this being sort of computerized bureaucratic hell. And I think I heard Andrea Horvath the other day say it's like the Hunger Games trying to sign up. Overly complicated, too glitchy. Question, why did you not choose instead a single portal that everybody would go through rather than what we've had in place for the last many months?
Because we felt it was really important that local public health units be able to devise their own system. Some of them already had a system that was working well for them. Others relied on our central system, but I'm very proud of the fact that all the places that were administering vaccines were able to have them all registered in COVAX, which is really important to understand who's been vaccinated when and with what vaccine. And it's also consistent with the work that we're trying to do with our transformation of the entire health system, that it's not as decreed by Queen's Park, what shall happen, but really up to local areas, such as like Ontario health teams, in this case, the local public health units, to figure out what's best for their own geographic area, what's going to work well for the people of Ontario that live within their region. So we wanted this to be useful in every part of Ontario, and that's not according to one system.
I have heard, admittedly, anecdotal evidence about people showing up and being told, well, sorry, you may think you checked it out ahead of time, you may think you qualify, but in fact you don't qualify, so we're sending you home. Other people have talked about the fact they've had to stand in line for hours and so on. Do you wish it had all gone more smoothly?
Of course, there have been some glitches in the system, but I think overall, I'm very pleased with it. One of the changes or one of the issues that has an effect on the glitches is when you open it up to a new group of eligible people, such as today, where we're opening up to people in the 10 geographic areas that have the most COVID variants, you have everybody on the phone first thing in the morning trying to get a vaccine. What we are saying to people is please be patient, because generally speaking, as the day wears on, you won't have to wait as long. You will be able to book your vaccination time without having to wait for hours on the phone. So it's really just a matter of people hopefully being able to call back later, to be a little bit more patient. But our system that has been able to take hundreds of thousands of calls during a single day and book hundreds of thousands of appointments, the system has not crashed, which has happened in other jurisdictions. There have been glitches, yes, but I am very pleased with the way the system is working overall.
Minister, I know you get lots of compliments from people that you know about how well the vaccine rollout has gone, so you don't need me to do that. I'm going to take the other side of the coin, which is to read something Robin Urbach wrote in the Globe and Mail earlier this month. Here's a little snippet from a column she wrote in the Globe. She writes, "Then there's Ontario, which for the last almost year and a half has been a rudderless ship with a neophyte captain drifting wherever public opinion blows, usually with 2 to 3 week delay. Premier Doug Ford has incessantly repeated that nothing is more important than protecting the health of Ontarians and also keeping kids in school and protecting our seniors and supporting small businesses and safeguarding our economy, which together means that nothing has really been more important than anything else. The effect has been a government that lurches from celebrating reopening plans to issuing dire warnings about ICU occupancies. Nowhere else in Canada have children been out of school so long, have seniors been hit with 2 equally devastating waves, have outdoor activities been so restricted for months, have retailers and other businesses faced such extended restrictions. And in exchange for these sacrifices, the province can boast average case numbers and above average deaths." Okay, that's a tough piece, and I'd like to give you a chance to respond to some of the criticisms she made there.
Well, I guess it won't surprise you that I feel quite differently about the situation in Ontario. From the beginning, we've always said that the health and well-being of people is our utmost priority, and every step that we've taken has been with that in mind. We have relied on the advice of our Chief Medical Officer of Health, our Public Health Measures Table, the Science Advisory Table, and others. So our decisions have been based on science, on clinical evidence, and that's what we always defer to the recommendations of our medical experts when making decisions. There is no doubt that there has been a lot of economic pain as a result of some of the decisions that have had to be made. But I think that's unfortunately similar to what's happened in different jurisdictions. And of course, I am very sorry for people that have lost their businesses and that have had such businesses and or their jobs. But at the end of the day, this is about saving lives. And this is what we have turned our minds to every step of the way, every day since COVID broke out in Ontario. We want to save people's lives, and that's what our decisions have been based on.
Now, of course, when you stood for election 3 years ago, you and your colleagues had obviously no idea that you'd be fighting a once-in-a-century global pandemic. So we understand that. It raises this question for me, which is, clearly you have had to learn hard lessons over the past year and a half, which presumably will be good for next time, because what everybody tells us is there will be a next time. If you could go back and substantially revisit a decision you made regarding fighting this virus over the last year and a half, what would it be?
I think what I would have wanted, and it's not really a decision, but it's a review. What I would have wanted to have seen was a well-documented pandemic plan and infrastructure for what we would need to do if we were faced with a pandemic of this magnitude. And that is something that this is not a judgment on any government at all. It's just that it would have been far easier to have been able to deal with the pandemic if we'd had, for example, an integrated lab system in place, if we had a well set up case and contact management system, if we had a system for developing the vaccination locations and types, to have had the information lines so that the labs can be contacted by the testing centers. All of those things would have been far more helpful for us to deal with this pandemic. But I certainly see that as my responsibility going forward to make sure that we document what we did during COVID and make sure that there is a pandemic plan going forward, because you're right. It's not a question of if another pandemic will happen. It's when. So we need to be prepared for that.
And can you tell us now with confidence that, given your experience of the past 15, 16 months, that whoever has to deal with this down the road next time will, in fact, be better prepared because of the experiences we've been through now?
Absolutely, yes.
Okay, we have that on the record. Let's play a clip now. We did a program not too long ago with some small business people, and we talked to one guy who owns a salon in Thunder Bay. Tony Muya is his name. And, you know, because of the government restrictions, which I take your point, you say have been necessary for the health of the people of the province, but because of them, he's been open 10 days this year for business, 10 days in 2021. And, well, let's hear from him, and then I'll come out of that with a question.
We've been a safe place since day one. We followed the guidelines that our local health unit, in conjunction with the provincial government, put into place. We spent thousands of dollars in plexiglass in between stations, front desk. We spent so much money on PPEs in our salon. There is nothing else that the government can put into place that makes our business any safer than what it was a year ago. It's been absolutely catastrophic, not just business-wise, but personally. What's happened for us is our numbers are so far down, it's crazy. What's worse, more than our numbers being down, is what the Ontario government has done to really ruin the importance of being a hairstylist or a spa technician in Thunder Bay. We are only 4 different businesses that are still closed in the gray zone. So many of my friends and I, we walk around and think, you know, we're almost better off dead than we are alive.
Now, Tony went on to say he's out $500,000 because he's had to been closed so long. He owes the government money. He's in therapy. His region, again, we checked these numbers this morning, his region has 9 COVID-19 cases. So I guess I want to know what your message is to him and his colleagues who have essentially been closed down throughout the pandemic.
Well, first, I would have to say that I'm sorry that this has been so difficult for him and for his colleagues, that this isn't something that we wanted to do. We had to do based on the medical evidence, and what we heard from the medical specialists was that in certain businesses, there's much more proximity, closeness of people to each other, and that's what happens in salons and in places that do things like facials, that sort of thing. And that's why we had to take the steps that we did. I know there has been some financial assistance for people in Ontario, but I know for some people it wasn't available and that they've gone through very difficult times. But we are doing whatever we can to get as many people vaccinated as possible so that we can move into step 2, which is where salons will be allowed to open, and then into step 3, which will affect other businesses as well. So we watch this very carefully every day. We're not prolonging this for any longer than we absolutely have to. And we want people to be able to get back to their businesses, to get back to their jobs, to be able to get back to all of their families as well.
I do take your point on all of that, but Tony's view would be, I think, if I accurately characterize it, you're a progressive conservative government. You're supposed to be looking out for the little guy. He's a small business person in a rather remote part of the province of Ontario. He's the kind of person who he thought you guys should be looking out for, and he spent the money, he believes, to make his business as safe as possible. And yet he's in deep trouble right now. Do you think you could have done this issue differently and given folks like Tony a better opportunity to succeed, pandemic notwithstanding?
I think that it's something that we have, we've been relying on the medical experts to give us their recommendations about what's safe and what's not safe. And, at the beginning, we didn't have a vaccine. And so we had to take this very, very carefully, which we did. And I know that many people have suffered economically, which we've tried to deal with in terms of providing some economic relief, both in terms of some grants that are available, but also in reducing hydro payments and so on. But I know that people have reached the end of this. I know that people are very anxious to move forward. We do have, our Minister of Small Business has been looking at these issues since day one, have been asking many questions. It's not as if we say that nothing can be open and that's the end of it. We have very vigorous internal discussions about what can and what cannot be open based on the medical evidence, but also based on the precautions that people are taking in their businesses. So this is something that doesn't just go unstated. There is a discussion with our Minister of Small Business and many others, because we are taking a whole of government approach to all of this. And that it's really important to hear about what's happening to various businesses and what we can do to mitigate some of the effects of the precautions that we're having to take.
Now, I appreciate that, but I think people would be interested to know if, for example, the medical officer of health says, you really must do this, but you and your elected colleagues think, okay, we hear that advice, but we actually think it's okay if we do that. Can you do that?
Well, I would say we take the medical evidence very, very seriously, because none of us are doctors, with the exception of one, Dr. Marilee Fullerton, who's in our cabinet. But I'm not a doctor, and so I need to rely on their recommendations. And it's not just one doctor, it's a series of people who are epidemiologists and other specialists in these public health issues. So I would say that all of us have to rely to a large degree on what they tell us. Can we modify it sometimes? Can we speak to it? And can we ask questions about how we can mitigate some of those recommendations? Yes, we do that. But we always have to rely on the science and on the clinical evidence.
No, I get that. But at the end of the day, this is the thing I really want to nail down. At the end of the day, you're the decider, right?
Yes.
So the buck stops with you.
Yes, it does.
And if the medical officer of health says, Minister Elliott, I think you absolutely have to do this, but you believe, science notwithstanding, that he's wrong, or you may have other views as well that you take into account, you can overrule him and presumably have along the way. Yes?
I would say that I've had discussions with our Chief Medical Officer of Health, and there have been situations where I have wanted further information in order to understand why certain decisions are being made. So it's not something that just, I hear it from the medical officer of health and therefore it happens. It doesn't work that way. There's an opportunity to ask lots of questions. And that's why I think it's really important to have that kind of relationship that I had with Dr. Williams. And now I hope to have, and I think that I will, with Dr. Moore, our new medical officer of health that's coming in, so that you can have that discussion, that you can understand issues, that you can ask if there can be mitigations or slight changes. That's the way it works, that you have to work together on all of this.
Dr. Moore, we should just clarify, is starting in a few days, and I wonder, could you tell us what you believe Dr. David Williams' legacy will be? When people look back at this time years from now, what will his legacy be to the past year and a half?
I think that Dr. Williams will have a very proud legacy, that he is the one that helped Ontario get through COVID-19 with respecting the lives of the people of Ontario, that he saved many lives with the recommendations that he made to us. And I am very, very sad to see him go. I have great respect for Dr. Williams, and I believe he did a great job. But I'm looking forward also now to working with Dr. Moore.
You no doubt heard the criticisms of Dr. Williams that he was kind of an iffy, sometimes even imperious communicator. What did you think of that criticism?
I think that we all have communication issues, but I think that it's the substance rather than the style that matters the most. And that's what I believe is the case with Dr. Williams. He had knowledge of public health for years that he put into great use as Ontario's Chief Medical Officer of Health during this really, truly unprecedented time.
Minister, I want to bring to your attention here something that Cynthia Mulligan, the Queen's Park reporter for City TV, has been doing since this pandemic began. And Sheldon, I'll ask you to bring up an example of this. She essentially retweets what your office puts out on social media. And here's an example under your name. Ontario's reporting 3,000 plus cases of COVID-19 and over 38,500 tests completed. Locally, there are 903 new cases in Toronto, 752 in Peel, 335 in York Region, 187 in Durham, and 150 in Ottawa. As of 8 p.m. yesterday, 6.1 million plus doses of the COVID-19 vaccine have been administered. That's what you tweet. And then she adds at the top, as people who can see this, and I'll describe it for those listening on podcast, she adds the death toll. 47 deaths is what she adds. So every time your office tweets out the daily cases, the vaccinations, and the test totals, she retweets and adds how many Ontarians died of the disease. And I'm just curious as to why, when your office tweets out those numbers, the death toll is not included.
Well, that was a deliberate decision that we made because I know that this has been very painful for many, many families, particularly families who lost loved ones in long-term care. And so that we chose to do that really out of respect for all of those who are still grieved.
Naturally, there are those who are not on side with your government who believe that the death count has not been included as a means of, obscuring or minimizing the consequences of the decisions that the government has made. Could you speak to that?
Well, I certainly wouldn't agree with that. That information is available on our website on a daily basis. There's no attempt to hide anything. We're very transparent and always have been with the people of Ontario about everything that's happened with COVID. There's information daily on our website. There are briefings several times a week by the Chief Medical Officer of Health on their own without any politicians being informed, which I think is important for people so they can understand what questions are being asked and to hear it directly from medical officers themselves. We've had many press conferences as well, but we have been open and transparent with the people of Ontario in all respects concerning COVID-19.
Okay, we're down to our last minute here, and I'm going to ask you, I note almost every day I get a press release of some kind saying that another Conservative MPP is re-upping or standing for nomination to be nominated or something like that, but I haven't seen your name. Are you running again?
Yes, I am. I've already been nominated in Newmarket, Aurora. I feel very honored to represent my constituents there, and I have been nominated, and I'm ready to go.
And you are definitely running for re-election a year from now.
Yes, I am.
Are there any circumstances under which you can imagine that not happening?
Well, there's lots of circumstances, but I hope none of them happen to me. There's an illness. I hope not. But other than that, no, I don't expect so.
Okay. Minister, we're grateful for your time tonight here on TVO. That's Christine Elliott, Deputy Premier, Minister of Health, and the PC member for Newmarket Aurora. As my dad likes to say, ministers, stay positive, test negative.
I like that. Thank you, Steve.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.